All right, let's go to pediatrician Dr. Dina Kulik. She joined us now to talk some more about this. Thanks for your time today.
Thank you.
Any specific concerns about daycares reopening by the end of the week?
I think as long as daycare providers and the spaces are being used, as you just heard, with 10 kids or less per space, meaning we're not going to have many children kind of on top of each other. If we minimize the number of kids per space, if we maintain really good hand hygiene and distance from those that are not within that 10-person group, and the screening that they're recommending, I think, is great to make sure that no one is being allowed in that has any illness whatsoever. And if we're really careful about this, careful about the toys kids are playing with, careful about making sure everyone is healthy, maintaining our distance, then this can be rolled out in a safe way according to public health.
Yeah, my concern would be, and you touched on that, toys, for example. Kids are always passing toys back and forth, and that could be a germ carrier. And kids are always touching each other, right? They're always holding hands, hugging, running towards each other. So how difficult will it be for the folks who are in charge or running those centers to try and keep kids apart?
It's going to be a lot more onerous for sure. So just the cleaning, just as you mentioned, making sure that toys are cleaned really frequently. They'll be getting rid of toys or setting aside toys that are more likely to be contaminated, things that are more difficult to clean, like the soft plush toys versus plastic ones that we can wash off more thoroughly. We're going to assume that the kids are going to come close to each other, but that's why we're keeping them to less than 10 kids per group, assuming now that that is now a bubble, if you will, just like you would have with your own family. This now 10-person bubble will extend outside for your family, but just be within 10 people in the daycare settings.
So, Dr. Kulik, one of the other things that seems to be of a concern for the operators of these daycare centers is that they have to decide now who gets to come back and who doesn't, because clearly they can't have a full house. And that sounds like their decision to make, which will be tough moving forward.
It's going to be a challenge for sure, because to keep them to less than 10 kids per group, now it's not necessarily 10 kids per daycare, it's 10 kids per space. So if there's multiple rooms, for example, at the daycare, they might be able to open up, again, keeping those 10 kids in one space, 10 kids in another space. And many parents are not going to be eager to send their kids back so quickly if they're able to work from home or they're not currently working. Perhaps some families will choose to keep their kids home. So maybe there won't be a big rush to go back, and there might not be so many kids that are fighting for those spots.
Do you feel comfortable then that the ones who do open Friday will be ready, that Ontario is in a position to do that now?
Look, the numbers are not zero, but we're not sure that the numbers will ever be zero. Kids, by and large, have done incredibly well through COVID. Very few kids have gotten very sick. Very few kids even have any symptoms at all. And it's hard to say how many of our children actually had COVID or were exposed to COVID and yet didn't get sick, and whether they could get it again or maybe they could never get it again. The numbers are imperfect, but we know that the numbers are relatively stable. Kids have done exceedingly well through this and probably won't get very sick even if they get it. The challenge will be to maintain that 2 meters and the 10 people per bubble when you're not in that daycare setting. So I still recommend that people stay, at home with their loved ones in their home, and otherwise in this just 10-person bubble, and not expand the bubble here and there and everywhere and inviting many more people into your home, for example.
Just one last question. If parents are thinking about sending their kids back to daycare, are there certain kids that shouldn't go back yet because of certain health concerns that could complicate a COVID-19 diagnosis, for example?
Yeah, excellent question. So in general, we're thinking that children and adults that have chronic health concerns like asthma or chronic heart disease, other issues, are more at risk, though that hasn't really panned out in this pandemic. Kids, again, are doing really well no matter what kind of conditions they have or whether they're completely well. Most kids do exceedingly well, have no symptoms at all, or mild illness. So unless your child's very unwell, in which case, of course, speak with your own primary care provider about that, they could probably go back if the daycare is maintaining those standards we laid out.
Dr. Dina Kulik, appreciate your time. Thank you for stopping by on the show.
You're welcome.